So welcome to the integrative approach to healing pain naturally. My name is Dr. Christian Carroll. I'm an integrative chiropractor. I practice here in Hopkinton, and I practice over in Groton at their integrative center over there. I split times between them. And when I was trying to figure out what to basically talk about, I was thinking about, chiropractic, typically people are talking pain. And while that kind of limits chiropractic, I want to expand that. I thought it was a great entry to talk about an integrative approach and start to expand people's minds into what's possible with healing. So we're going to kind of start really nerdy. And you don't need to understand this, but basically this is the pathways for how pain gets observed in the body. So like if you get pinched, like why does it hurt? Right? If your leg is walking and you have some weird hip pain, like why does it hurt? It doesn't hurt until this little green area in your brain decides that it should hurt. Okay? So basically you can have, there are all these nerves that go from your feet all the way up your spinal cord, and then they synapse right in that green part of your brain, and the brain decides whether it's going to be painful. So why do some people hurt and some people not hurt? And that's what we're going to kind of dive deeper in today. So that's a bunch of nerdy stuff. We don't really need to do it. But basically, all those nerves are these electrical impulses, and they're firing and they're talking to each other all the time. There's a threshold basically on whether or not it gets to the green part of the brain and says, hey, that's pain or that's not pain. And that threshold is what we're going to be trying to lower or actually higher today so it never fires. Does that make sense? I know I tried to do like a picture, but I didn't want to get too technical. So let me explain to you the way that I view the body in an integrative manner. Some people throw around the word functional medicine. We're going to throw a model into the picture called the triad of health. So no matter what you have, digestive issues, foot pain, back pain, cancer, all of these things can be broken down into three things. Now those categories are large and they can encompass a lot of things, but basically it's three things. It's structure, it's emotional stress, and it's nutritional or physiology. Okay? And we're going to break down each of those. And my goal for you today is for you to leave with practical tools. I'm going to give you three major ones, my three favorite ones from each side, and that's in your notes, and we'll go over those, on what you can do today to basically bring home the healing power. Because a lot of people don't realize that you can heal yourself, that you have the tools and you have the power within you to take control of your health. Healthcare is not just you walking along and you just like hope you don't get sick and then you get something and then you go find someone in network. Health is a choice every single day that you make, okay? So I'm going to help you make some choices that have high leverage or high healing capacity. Does that make sense? You guys tracking? All right, so structure. Let's start with the bottom, right? It's the base of the triangle, so we need to explain that. So this is my lovely assistant. Oh, good, it's landing. So let's talk about structure. So I'm a chiropractor, obviously, and I love bones, and bones love me. So this is your brain. It sits in here, right? So the skull is taken off for a dramatic effect, but basically the way that the body communicates to all your organs and all your muscles, so I can do this, so my heart can beat a little faster today than normal, is the brain's basically interpreting all this stuff, and it sends information down the spinal cord, which is right in here, and then out between each of these bones, okay? If the bone is misaligned, chiropractors call that a subluxation. You can call it a fixation. You can call it stiffness. Whatever it is, it's basically impeding the nerve's ability to communicate with whatever it's going to, whether that's a muscle, whether that's an organ, right? And each layer, and I'm going to show you these because these are kind of cool. This is a nice chart. This is a nervous system chart. This is called the autonomic nervous system. So the brain is interpreting all of this information, brain to body, body to brain, 24/7. It's a pretty magical organ. It's probably the most important organ in the body. So like for instance, right through this area, so this upper spine right here, are those nerves go to the heart, right? So an early sign of heart attack is actually really stiff upper spine. In fact, it's so important to know that because I'll give you a story. This professor of mine in chiropractic school, he was trying to explain the power of an adjustment and how important the nervous system functioning can improve someone's life. And he gave kind of an extreme example. This one guy, and you shouldn't do this, but this one guy had came into the seminar and he was having really tight upper back pain. And he was like, hey, can you adjust it? I haven't been feeling good all week. I haven't been feeling good for a number of years now, but just I'm tight. So he was getting adjusted An hour later, he would need it again. He's getting adjusted. I mean, he's at a chiropractic convention, so he's got plenty of people that will move bones, right? So he's having fun. He gets to the weekend. Monday morning, he's in the ER. He had a heart attack. So what does that mean? Was the chiropractic working too well and actually postponing his heart from failing? I don't know. But the moral of the story of that is that the structure impacts the nervous system and can really augment how well your body can run. Now, instead of it being an acute crisis, let's just think about that through our entire lives. The better functioning our nervous system, the better we're able to express ourselves in the world, which is important. But we also know that just fixing the structure isn't it all, and that's why it's part of a whole triangle, okay? So to piggyback on that kind of concept and just to explain it, I want to introduce a little demo for you, because what moves bones? Muscles. And there's more muscles than there are bones. And so if bones move muscles, then we got to balance the muscles in order to balance the structure. Is everyone tracking with that? Okay. So I am certified in applied kinesiology. That's part of the letters after my name. And that's basically the study of muscle testing. Okay. So for instance, a lot of people have had the experience, maybe, who has been adjusted in here? Who's been to a chiropractor? Cool. A lot of you have come to me, so this isn't necessarily something that you have run into. But a lot of people are getting adjusted, and their muscles may or may not be fixed alongside that. So as soon as they leave the office, the muscles are imbalanced and pulls the bone out of place again, and you immediately feel what you felt pre-adjustment. So it's important to balance the muscles. Now, since basically the theme of this presentation is take-home stuff, I want to give you some stuff that you can take home, because you can't adjust, right? I mean, I've taught my sister how to adjust, but that's not necessarily the best way to do it, right? So let's give you a real-life example. And so before I got really deep into the other sides of the triangle, the nutritional and the emotional, I hung around a lot with a lot of the top physical therapists in the Chicagoland area. I went to school out there. And basically, I was fascinated by how the body moves. And this new thing in physical therapy land is called functional movement. You know, just like in the naturopath world, in the medical world, there's functional medicine. In the physical therapy world, there's functional movement and how well we move our bodies. Everybody is kind of into that, right? The better you move, the better your structure is, and the better that you feel. Well, these I put together at 4 in the morning last night because I had a revelation. And these are basically the 15 take-home exercises that you could do to address most imbalances in the body on most people most of the time. Now, I want to give you a demo of that. Does anyone want to come up and be a demo? Jen, would you like to? Okay, so let's have some fun. You guys don't want to just listen to me talk, you want to see it. Hello, wonderful. This is my mentor, by the way. 10 years ago? 11?
How old are you?
12? Yeah, probably. Here, stand up for me. All right, let's watch Jen. So one of my mentors used to say this kind of profound thing. The gait of man is the fate of man. Has anyone ever heard of the concept of gait? Neither have I, so don't feel bad. Have you heard of gait?
The way you walk?
Yeah.
It's the way you stride?
Yeah, exactly. So I was sitting in you can sit down, I'll do it. So I was sitting in chiropractic school in my very first class, and I don't mean this offensively, but we had an Indian professor, and he was up there, and he was like, and when the patient walks in, and they're gay, and they're gay, and they're gay. And I'm like, is this guy calling the guy gay? Like, what? And I couldn't understand him because I had never heard of gait. And my friend looks over at me, and he's like, he's talking about gait. I was like, what is that? And he's like, the study of movement. So every muscle in the body actually correlates with an organ. So you can watch someone walk, you can watch them move, and you can tell immediately what organs are stressed and not stressed. Pretty interesting. And is it a two-sided triangle or a three-sided triangle? It's 3. It's a trick question, right? So that means that there's 3. Right? There's actually 3 things. So every organ in Chinese medicine has an emotion associated with it. So you can watch someone walk and have a good idea what their emotional health is or what's bothering them. I'm not going to open that up for you.
Thank you.
Sorry. Right? At least this is what's going on in my head, so be careful. All right, so stand up for me. So let's just take a look at her posture. What do you see? This shoulder is a little higher than this one. Why is that? Well, that could mean two things. Either one muscle is tight or the muscle is weak. Everybody is taught to fix the tight muscle or to release the tight muscle, right? Have you ever met someone that's stretched their hamstrings enough? Nobody. So what are we doing wrong? We're trying to stretch the tight one. We got to fix the weak one. Because the nervous system is really smart. It likes stability. So if part of the joint gets weak, the other side will get strong or too tight. It almost overshoots it. So if this shoulder is weak, we got to figure out what isn't pulling it down. So this is probably a little yucky on her. I can't see her face as she wants to punch me. So we're going to do a little muscle testing. We're going to just check basically the nervous system's integrity in the muscle. So I want you to pull into your pocket. I'm going to pull out. So she actually doesn't have a great lock here. The neurologist would call that, they would call that a 4 out of 5. This side we can check too, squeeze. And that side's pretty good, right? So this upper trap is probably too tight. What do you give that?
Out of a 10, probably an 8.
An 8? Oh, you need this too.
I know.
All right. She needs an adjustment. All right. So this muscle, can you turn around? Sorry.
All the way?
Yeah. So what we just tested was the lat dorsi. You ever see the pull-up muscle? Okay. So that muscle goes from right into the shoulder and the arm, really, and it goes right into the low back. And so when that muscle is firing well, it holds this down. Do you guys follow? If that muscle is weak, it rides up. Okay? So because I can't adjust, because you guys can't adjust, I can adjust in the office, but I want to leverage this, so I want to give you take-home tools. What could we help to fix the nerve supply of this muscle? We could give her some exercises. And these exercises revolve core stuff, because we want to stabilize the low back, so the core. So we're going to give her some core. So I'm going to have you do what we're going to call the side bridge, right here. So I want you to, face them. And has everyone ever heard of a side bridge? So it's called side plank. So here's the thing. I don't think I have enough time to go through all 15 of these, but YouTube has all the time in the world. So if you're interested, in fact, it used to only be 10 minutes, but now you can do is unlimited uploads. But basically, if you type these in and like exercise into YouTube, like the first 3 are always really great demos, okay? And I would encourage you to do that. If you don't want to do that, I'm going to work tomorrow or this weekend, depending on the Easter thing, to actually do a run-through of me on a patient teaching them. So you can take this home. You can subscribe to my YouTube channel. Now I have one. So fancy. All right, so I want you to basically hip hike. Exactly. So basically the big thing here is you want to make sure that they're all stacked. If she starts cheating, she'll start rolling. So she's activating all of these side muscles, so your obliques. She's activating part of her glutes.
See how I'm shaking?
And she's shaking. You can let it go now.
Thank you.
So she's so Dr. McGill is the leading spine biomechanist in the world. This guy's super nerdy. He puts electrodes all over you and studies the muscles and what the body needs in order to stabilize so you won't have back pain. He said that the patient who can hold this and get this 62.5 seconds, I don't know why it's 0.5 seconds, so let's just say 63, but his research says that. If you can hold that on each side, he said you won't have back pain. So it's kind of important. How long did she go? Maybe 20 seconds or so?
I think it was 2.
Yeah, I'll round up. Here, you can come on back. So we at least activated the muscle, right? Sit up. Okay. Let's see if we had an impact on the muscle. If not, we can go to a different one, but I have a feeling we did. So squeeze. And now that's pretty good. And her shoulders are even.
Well, that's much better, too.
Much better? What do you got?
I don't, there's no pain.
So 8 to a 0. You can do this. This is not magic. This is biomechanics and applied in the right way. Thank you.
You're welcome.
That was awesome. All right. Did I have your attention? So that's only one side of the triangle. Thanks, Mom. I have a good crowd here, good home crowd here. All right, so so you can subscribe to YouTube if you want to watch me do this on other people, or you can just plug it in yourself and watch other physical therapists do it. All right, so let's move on from that. So that was actually only one of the top 3 that I have for the structural side. This next one is called Dr. Fulford, who is an osteopath. I learned this from my mentor. He usually would do it, we would have really long seminars in chiropractic school. I used to go to a lot of weekend seminars, and I just was very fortunate that I had really great mentors that traveled all through the Chicago area, so I got to learn from the best of the best all over the country. And this is something that he would do when people would start getting tired in the middle of the seminar. He'd be like, all right, everyone up, we're doing Fulford breathing. This guy was an osteopath that was pretty obsessed with balancing the structure of the body through breathing. And so if you guys want, we can do this. Does everyone want to do this? It takes like 3 to 4 minutes. Cool. All right, everyone stand up. Okay. All right, so basically feet together. What you're going to do is you're going to place the tip of your tongue behind your front teeth. Now, that sounds funny, but it's called the centering point, okay? And then when we do the breathing, we're going to breathe in through our mouth, leaving the tip of the tongue right there. And then we're going to breathe out through our mouth, leaving the tip of the tongue there. So breathe in. And I usually have to open up my mouth because you got to let it go, right? But you leave the tongue there, okay? So we're going to do that 7 times, and we're going to do it for each of these postures. And the way he figured it out, it was researched over lots of time. I can't ask me, I just know it works. And I could show you some muscle testing if you wanted, but lots of things will start changing. Changes the ionic balance in the brain. It changes actually some mineral stuff. So like left-right nostril breathing, it helps balance left and right brain activity. I feel lighter after it, so you guys can have your own opinions. But basically, we're going to go feet together, left palm up, right palm down. Okay? And we're going to do 7 of these. So breathe in. Out, 1. Just keep going. 2. 3. Okay, when you get to 7, now we're going to switch some stuff to change the muscles. So we're going to do left over right. Same thing. So now we're rotating up the body and doing different breathing. Same tongue, 7 more. All right, and then right over left when you finish 7. If you have balance issues, 7 more. Okay. Now you can sit down and do the last one. This one helps to reground us. Basically what you're going to do is you're going to lean forward with the same tongue in the same position, and we're going to do 7 more while you hold the inside of your feet, okay? Deep breath in and let it go, 7 times. You can come on up. Welcome back. How are you feeling? I feel like a little clearer in my eyes, but that may be just me. Okay? So that's something that you could use. I could have demoed a bunch of muscles changing and things like that, but you guys get the idea, okay? It's a pretty simple technique. Here's actually how I've used this. Who has had trouble waking up in the morning when they're exhausted? I will do this in the morning, and maybe on this one, I'm like, my eyes will start opening. I'm like, well, that's weird. And I'll start getting energy again. I don't know why. It just starts working. It helps with the nervous system, right? Which is important. All right, so moving on. How many people hate doing cardio here? How many people do not like doing cardio? Eliza, raise your hand proud. No shame. Okay, this guy, Dr. Phil Maffetone, works with the best triathletes in the world. So he has my attention because he's working with the best of the best. Over time, he's found that the equation, the 220 minus your age equation that most of those machines in the workout places are made on, they're wrong. It's actually too high, which is why, it kind of explains why most people really don't like it, because most people are already adrenally fatigued and exhausted, and now you're running basically too high. And the reason I'll explain that, I don't know, did I do it on this slide? No, we're going to do this. So the way to figure out the new equation is to take 180 minus your age, it's a small window, is the top number. Then you take the top number and you minus 10, and that's the bottom number. It's a small window. So if you're 50 years old, it's 180 minus 50, so it's 130 to 120, okay? That heart rate is important to know for a bunch of reasons. The best reason is that at that heart rate, your body only burns fat and doesn't burn sugar. Can I get an amen, ladies? Right? So one of the things that's really important is when your body is burning fat, it's more efficient. Because sugar only has 4 kilocalories. Fat has 9. So your body's actually more efficient. So these triathletes are just crushing their numbers doing this and building their strong aerobic base. The reason I like doing this, and I didn't like it before, is because every 15 minutes I get a runner's high. If I stay in that zone and you need a heart rate monitor, unless you're like a genie and you can know what your heart rate is at all times, I found that every 15 minutes on the 15-minute dot, I don't know, that might just be my physiology, I just got this release of like runner's high. And I was like, I understand now why people run. I get it. It feels good. So I do this. It's important. I'll give you a quick story of how powerful this is, actually. A woman comes into the clinic, 26 years old. This is while I'm in chiropractic school. We adjusted her, and we gave her this. That's it. Nothing fancy. For 3 months, she's never had a normal period in her entire life, and she was extremely emotional. After doing this for a couple months and getting adjusted, perfect periods. Every 29 days, she would get it. Normal, all that good stuff. Her emotional level started stabilizing, her blood sugar started stabilizing, and the hormones ride blood sugar. So the better that was, the better she was, and then her whole cycle changed. That's without drugs, people. And you can do this. You have it. It's just an equation, right? So that's what I'm here. All right. So the part that I really like seeing the most is how all 3 sides of the triangle are always interrelated and they're always integrated, and it's never just one. I'm going through step by step and separating them, but realize that they're all happening all at the same time, okay? So like, this is one of my favorite quotes, like, food is the most widely abused anti-anxiety drug in America, and exercise is the most potent yet underutilized antidepressant in America, okay? And Bill Phillips said that. He's a pretty smart dude. So realize that all of these are all affecting each other all at the same time. They just published in the Journal of Psychology, I can't remember which one, that exercise, 45 minutes, moderate exercise, is better than every single antidepressant drug on the market. And that's in the literature. That's not my opinion. Cool. All right, so let's move into the other side. So physiology, it's a fancy word for all your organs working together. Okay, this is like all this stuff going on. So let food be thy medicine and medicine be thy food. This guy said that a long time ago. His name is Hippocrates. Every medical doctor, when they graduate, says what? Oath. The Hippocratic Oath. It comes from this guy. But somehow, according, over time, it didn't make that much money when you, use food as medicine instead of drugs. So, I don't know. Just food for thought. I thought that was interesting. So whenever we're dealing with rebuilding a body, whenever we're dealing with healing, whenever we're dealing with a sick patient, you always, 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 always start with the basics, okay? I threw this in there. They call them the fundamentals because when you get them, you have a lot of fun, right? So you have to start, like all of my mentors stress this to the max. If you do not fix the basics, you're going to chase your tail all day long. all day long. You can fix all this fancy stuff. You can do the triple karate thing, but if you can't learn to jab, you can't fight. So the basic, like the basics. All right. So the 3 most important things, if you must know, are blood sugar stability, proper hydration, and actually protection from negative people. Those are the 3 most important things that you can do for a strong physiology. That's a physiology that can handle stressful events. That's a physiology when your baby wakes up in the middle of the night, you don't feel awful the next day. That's a physiology that you can go run 5 miles if you want or go play a hockey game after a long day. That's a physiology that will keep your mind and body sound and still able to give your gifts. Because why are we here? Are we just walking around? Or are we trying to give something back to the world? You want a strong body so it's a servant to your spirit, not the other way around. Make sense? All right. I found this today, actually. E equals MC squared. We'll address that later in the emotional session. But blood sugar balances will always make you in pain and it will make you tired. Okay? And actually, if you want to get out the survey, says blood sugar symptoms. I put this together because this is for you. Whenever you experience any one of these symptoms, know that your blood sugar is off. If you experience a lot of them, and this is the tally at the bottom. For some reason, stage 2 didn't come out, but if you want to write in your notes, stage 3 is 5 to 8 symptoms. Okay? So if you want to go through it now, I would encourage you to circle and kind of count how many of you have. Okay? If they start going up and you have a lot of these, it might not be a bad idea to get your hemoglobin A1C checked by your doctor. It costs $5. I don't even think it's a cost to you, but it's a good thing to know. Because there's so many people walking around right now with prediabetes, like a lot of people. And most of those people are actually low blood sugar patients for a long time, for like 20 years, and then the body just starts losing their ability to track it, and then that's when you start seeing the diabetes. But most of the time, they're actually fighting low blood sugar. They're functionally low blood sugar for most of their life. So this is important. And if you have a lot of these, we can talk after, but I can show you the nutritional supplements to balance that. So the 2 organs, the most important organs that balance the blood sugar when it dives is the liver and the adrenals. Has everyone heard the concept of hangry? Yes, everyone, right? You're like, yeah. Does no one maybe explain to you how that happens? It just happens, right? No. When your blood sugar dips, such as a long time since you ate, okay? This is my long time. If your adrenals are tired, since they're handling all your stress, the liver will handle it. And the liver would rather detox than handle your blood sugar. And the emotion of Chinese medicine in the liver is angry. So it has to overwork. So you get hungry, angry, hangry. And that's where it comes from. But you have to look at a lot of systems to see that. All right. So Vic Frank was the guy that came up with that 3 most important thing, which was blood sugar, drink your water, and protection. So he said that anybody that ever walked into his office had 2 major problems. They were dehydrated and they couldn't handle their sugar. That's it. And he said everything else was basically relative to those 3 things. He used to say this: water is the most effective anti-pain drug on the market. Most people, most of the time, are dehydrated, and it's free. Turn on your tap, maybe get a filter. This cool story about this guy. This guy is a chiropractor and a naturopathic physician from Salt Lake City, Utah, and he was born or gifted or cursed, depending on how you want to look at it, with really bad blood sugar handling. And so most of his life he was sick, and he couldn't get out of bed, and he wasn't treating patients, and that was what he was supposed to do. So he decided to basically do a lot of experimenting, and he came up with a diet that you guys know as the Atkins diet. This guy's mentor is my mentor. And because he was a chiropractor, he felt like America couldn't handle it coming from a chiropractor, so he gave it to his friend, Dr. Atkins, who made a little bit of money off of it. Cool story, right? This goes back into the blood sugar thing. So most people, most of the time, are running on this. What does this look like emotionally? Manic, depressive, bipolar is a blood sugar issue. Oh, that's good stuff. That's important. All right, and since this talk is on pain, there's inflammation involved. What are the 5 most inflammatory foods that you can possibly eat? They'll inflame your gut, they'll inflame your brain, you'll get brain fog, and they'll inflame all your nerves. The 5 ones, my mentor calls them the 5 fingers of death. It's pretty in your face to get your attention. He's a pretty intense guy, so that's okay. I'll water it down, just call it the 5 most inflammatory foods. So number 1, sugar, right? If you have a sugar imbalance, you're going to hurt. Grains. That's not gluten-free, that's grain-free, because even some of the gluten-free grains inflame the body, and that depends on your tolerance. But if you're in pain, I would highly encourage you to avoid all 5. Sometimes when I'm with patients, instead of, that's like a lot for some people to just be like, oh yeah, just cut out everything, meat and veggies, right? So what I usually do in the office is I test which one they are most reactive to, and I say, can we do that for 30 days? Can we cut that out? Is that cool? And they're like, yeah, because I'm here and I want to get well. Okay, let's do that. And then we go from there, and then, you know, onward and offward. But the idea is that we're like unloading this inflammatory load bit by bit, because I'm more interested in you at 75 than I am in 5 years from now. Because if you make these choices over the course of your life, these are huge gaps in where you could end up at the end of your life. Okay, remember, health is a choice every single day. Quick tidbit on dairy. It's really tough on your kidneys, and if you know anybody with sinus infections or a lot of like post-nasal drip or stuffy noses that nobody can fix, get them off dairy and it clears up a lot of the time. That was for me. Soy. Soy, Dr. Francis would say, turns men into women and women into men. It's pretty intense. He had this patient come in, this 12-year-old kid, and he had all these weird like female issues. And his mom was like, what is going on with this kid? And we'd go through a diet history, and he was drinking a quart of soy milk a day because he was dairy allergic. So it made sense at that time because there wasn't really almond milk where he was. He was like, you got to stop drinking soy. All his problems went away. Interesting. And then corn. And this one more is like corn syrup, and this one more is like soybean oil. It's not like people are running around eating edamame all day. They hide it in salad dressings, they hide it in processed foods. You got to look at it. It's cheap. The President of the United States, I can't remember which one, but he basically challenged all these food manufacturers to make food cheaper for Americans so they could afford a higher quality of life. The problem is they took out all the good stuff and put that in because it was cheap. So they made food cheap. On a percentage basis of our income, we've never spent less on food and we've never been more sick. Sort of interesting. All right, our genes are not to blame, okay? So this is the way I see it in the office. This is where I see it with my patients. Your genes are important, but they're not really important, okay? Basically, every time you choose to put a piece of food in your mouth, you're either upregulating pro-inflammatory genes or you're upregulating anti-inflammatory genes. You're either turning cancer off or you're turning cancer on. It's that real. And nutrigenomics has a bunch of really cool research coming out, and it's been coming out over the last 15 years, and it keeps getting better as people are awakening to this, showing those pathways. You don't need to know it, you just need to know the application of it, and that's why I give it to you in these applicable bite size. So, and I also like doing this. So like I've read all of these, and you go to the Barnes & Noble, and there's like a wall of, you know, Joe Schmo's 30-day lose fat, diet free, you know, and gluten-free this and all this cool stuff, and everything is like this new fad, but what do they all have in common? I'll save you like 50 books, because I read them. Stop eating junk food, okay, step 1. Drink more water, step 2. Step 3, less sugar. Step 4, stop bad fats. So if anyone is eating margarine in here, I'll personally trip you. Margarine, it will clog your heart. Margarine is not good for you, okay? And if you look at Time, there's like a Time magazine in like the 70s when they were like really bashing butter, and then they just had another one where they came out and they're like, actually, we were wrong, right? So the fat thing is important. The omega-3s, good, they're anti-inflammatory. The omega-6s are grains, soybean oil, corn oil, vegetable oil. All those omega-6s are pro-inflammatory. They are going to make you hurt. We don't want that. We want fish oil, flaxseed oil, chia seeds have that stuff, all that kind of stuff. Omega-3s are important. MCT oil, coconut oil, cook with that stuff, okay? And then obviously eat more veggies. There's not one diet anywhere in the world that's like you shouldn't eat veggies. So I threw it in there. So now you've officially read 50 books on diet in the last 1 minute. Okay? You get the idea. I like to prescribe the human being diet. I thought this was pretty funny. My mentor said if you want to know the function of something, look at the design. Ben Franklin said if you put a sundial in the shade, it's useless. So look at the function, and it will determine your design. So if you want to know the function of a human being, just look at their teeth, the way that they were designed, right? So we have teeth like tigers in the front, our incisors. So that's for ripping up meat. So we need protein. Protein's huge. Protein also does what to the blood sugar? Stabilizes it. And how important is blood sugar stabilization, everyone? Important. And then the back of our teeth, we have those little like grinders. They're teeth like deer, and deer eat vegetables. So we need vegetation. So the designed diet of our mouths is meats and vegetables. This is also a very blood sugar stabilizing diet. This is also an anti-inflammatory diet, an anti-cancer diet, an anti-pain diet. You got the picture? Did I hit that home, everyone? All right, so let's recap real quick. So we've done two sides. We've done structure, so we've done some functional movement. We've learned how to move well. We've learned some breathing. We've learned how to actually balance our bodies with cardio instead of ruining them. We've done nutritional stuff, balancing blood sugar, drinking more water, and avoiding the 5 fingers of death. But now we got to go to that elusive final triangle, or that side of the triangle. And that's what Americans, because we're very proud, we call stress. Right? We don't want to label it. We don't want to say I'm angry. We don't want to say I'm frustrated. I don't want to say I'm stressed. I'm just stressed. This is sort of interesting. I'm going to take you a little bit into this. The person that you love is 72.8% water. Let me give you the application of this, okay? This is cool. Follow me. This guy, Dr. Emoto, figured out this technology where you could take pictures of water molecules. This water holds vibration. We know that. What do you think that word is? Any guesses? So that is a picture of a water molecule with a certain vibration from a certain word. Love. That's what love looks like on the water level. How cool is that? Remember? Right? What's the worst thing that you could do according to Chinese medicine? Have the patient lose hope. That's what hope looks like. And that's what water looks like when someone calls you a fool. 75% of you will look like that. You get the idea. Isn't that insane? And a newborn is 90. That's why you gotta love those babies. All right, here's another example. When someone says thank you, that's the vibration. When someone says you make me sick, when someone loves and appreciates you. This is before prayer and after prayer. Sort of interesting. This is a quote that I was doing some research. I sort of like asking like outside of the box questions if you haven't, kind of already gathered that from me. So I said, if Jesus was a nutritionist, what would he tell you to eat? Sort of interesting. All right. I'm going to dine with you. So I found this quote. What goes into someone's mouth does not defile them, but what comes out of their mouth, that is what defiles a man. He said that in Matthew. So it's this side of the triangle. It's important. Look at that. That determines your structure, your pain, how well your organs are working. So let's do something fun. When someone walks in, they say, oh, I hurt here, all this stuff, right? Think of pain as a metaphor. Your body's pretty smart. It wants to give you a good idea on how to help it out and do life well. So if you hurt in certain places, think about it as a metaphor. And the way that I'll explain it is this. If you have neck pain, the first thing I ask is who's a pain in your neck? If you have back pain, the second thing I ask is who's a pain in your ASS? If you have Here's a great story. I had a new patient today at 11 a.m. She hobbles into the office, 10 out of 10 pain, barely able to get in. She's seen the 3 top specialists, foot and ankle specialists in Boston. She lives on the waterfront in Boston. There's no expense that she's spared to try to get out of pain, and she has not been out of pain for at least 6 weeks. And prior to that, she had hip surgery of a couple months, so this woman is in pain. 10 out of 10 she describes as she hobbles in. I said, feet move us forward. What are you having trouble moving forward from? She looked at me like I had 10 heads. She was like, I moved out of Holliston for 27 years, and I lost all my friends. And she's had a hard time not hanging out with her friends. And so we did a technique I'm about to show you, which is where you hold the emotional points. You ever see someone get anxious or nervous? Where do they go? It's like their inner doctor knows how to treat them, right? And I said, well, hold the other place where you feel that emotion stored. And she was like, it's funny that you say that. My stomach is upset. So she holds her stomach. It's like, all right, sweet. Breathe. So basically what you're doing when you're doing this is it's all right. You'll be fine. I'll get an adjustment. So basically when you're doing this is you're basically resetting the nervous system's response to the emotional stimuli. We have the limbic center in our brain. And then our nervous system kind of figures it out from there. If it's unresolved, sometimes it's stored in the body as pain, right? So think of pain as like resistance to life, okay? So go with the flow is very important, right? So she breathes through this. She comes down. I'm like, okay, how are you doing? She gets up off the table and she's like, I don't feel it. I was like, you serious? She's like, no, I don't feel it. I was like, all right, see you later. Tell your friends. Right? So that's what I got. Understand this, the louder the pain, the louder your soul is trying to get your attention. Here's another way of breaking it down. The left side of the body is male relationships. The right side of the body is female relationships. How are we going to remember that? Women are always right. Right? Got you, Mom. Okay. You get the idea. So basically, pain is you're resisting something in life, or inability to jump when your heart is called, or blocking something, or holding on to something, or not forgiving someone, or whatever. But just a couple examples. Patient had right shoulder pain. This is a throwing athlete, so it's important he needs his right shoulder. This type of patient, when I asked them about, basically think about like Atlas, like metaphorically, like shoulders. You're putting all this pressure on yourself, all these expectations about how you should do life, right? So when we worked through that, I was like, write down all these expectations that you have about yourself and just start releasing them. Like, why are they there? Who told you to put it up? In the environment that they put you in. He started doing that, and he's able to throw now without shoulder pain. Pretty interesting. Now, it helps to also have the other parts of the triangle. It'll be faster when the other parts of the triangle, but it's important. Patient had left thumb pain. I'm like, what do you do with left thumb pain? Well, you put it in the triangle, right? So I was like, how is your diet? Okay, great. Get that out of there. Okay, are your muscles balanced? Okay, great. But it's still there. Okay, so we got to go to the last part of the triangle. What can't you put your thumb on? And I was like, it's probably a male. She's like, my husband. I was like, I can't fix that. But you get the idea. It's just, I think it's rewarding for people to know where this stuff is coming from so they can kind of start figuring it out themselves. Because when the power comes back to the patient, good things happen. All right. So everyone can kind of just do this. We can just do this together. Everyone want to do this? Is that all right? Yeah. All right. So we're going to think about something that's really stressing us out. It's awful, right? So in this picture, she has her holding the wrist. The reason for that is because these are the points in acupuncture. So she's kind of combining meridian and acupuncture with emotional points. We can do that, or what I like to do actually is a lot just touching our heart, because our heart's very centered in how we live. So I want you to just put a hand on your forehead, close your eyes, kind of center yourself, and just think about something that's like really stressing you out, or that you've been having trouble with. And when you're there, I want you to ask one question to yourself. What is the hardest part about that for me? And I want you to think about that answer and the way it feels. And I want you to just put your other hand on your heart and just breathe through that feeling. You don't need to worry about suppressing it. You don't need to worry about putting a positive spin on it. You don't really need to do anything. You just need to breathe. Focus on the feeling and breathe. And what you might notice is this charge inside of you, this like uncomfortable feeling inside of you. You might feel like a 6, a 7, an 8 on a scale of 10. Some people might be at 10. Usually the people that are in pain usually have some things that are up there in the 8, 9, and 10 area. But I want you to just breathe through this until you find that it just starts coming all the way down to like a 0 or a 1, and you'll feel this like inner stillness, almost like an inner peace related to it. It's just the nervous system relaxing and getting into parasympathetic mode. Deep breaths in and all the way out. Whenever you feel that drop down to a 0 or 1, you can just come on back, hang out with us. How are we doing? That's powerful. That is really powerful. What I like to do is I would encourage people to just write down things that they're struggling with and just kind of clear those out and just help reset the body. Back to Vic Frank.
What is that one question you asked yourself?
What's the hardest part about that for you? And then you can ask that again if you want. I do that with my patients. We just go all the way down to the core. Usually you can find someone's core fear. It's pretty deep. I was thinking about demoing it. If there's a brave soul that wants to put their heart on the line, we can do that. But it's pretty powerful. Does anyone want to do that? Does anyone want to volunteer? I'll show you the process of doing that. Yeah, you want it? You experiencing any pain?
Oh, that's funny.
As you limp up?
Yeah.
Gait of man?
Where?
What do you got?
Neck, back.
Let's start with the neck.
Okay.
Here, sit right here. Face the lovely audience. Sit up straight for me. Where have you been experiencing the pain? Okay, and how long have you had this pain?
Couple years.
Couple years?
Mm-hmm.
What's the pain right now?
Probably an 8.
Probably an 8. So right now she's 8 out of 10 pain. Thank you for coming, by the way.
Welcome.
Appreciate that.
Thank April too.
Okay. Oh yeah. So what happened a couple years ago when the pain started? What was going on in your life?
My daughter needing to go to a different school, severe bullying, and all that kind of stuff.
Traumatic experience. Can I help you with that?
Please do.
Okay. So I'm going to borrow her arm here. So we're going to show some muscle test. You can just lower that. So muscle testing. So good for her body. Her nervous system will be strong. It'll stay strong. If there's something that she doesn't like hearing or that is stressful to her, it'll weaken the nervous system. Weak. Make sense? That simple. All right. So all I'm going to have you do is just meet my pressure here. I'm going to push down. You just press up, okay? Go ahead. So she starts with a strong muscle. I want her to touch that part in the neck that hurts. And then push up here. So we have something going on here. So in that area, I'm gonna touch basically her emotional points, and we're gonna go into it. Okay. Push up. Okay. So when I touched her emotional points, that pain center now changed. When we touched the neck, it went weak. When we hit the emotional points, it went changed. If they didn't go change, we're thinking other sides of the triangle. We're thinking maybe she needs an adjustment, maybe she needs some nutritional stuff. But for this one, we can go right into the stress. And she volunteered like a brave soul. So we're going to go right into it. Okay? Just out of curiosity.
Mm-hmm.
Yucky?
Yucky.
Yucky. That doesn't feel good.
Mm.
So this is my other patient. Right here, basically, her neck feels like super locked up and jammed. And she's got some muscle guarding to fix that. But it's causing some pain on these nerve roots, okay? Now, if I was just a chiropractor, I would just crack the crap out of that. And if I was just a nutritionist, I would give you some adrenal and probably some anti-inflammatory herbs. But I am operating on the triangle of wellness. So, let me just put this back. Sorry. All right, think about daughter changing schools.
Yep.
And when you're ready, just push up here. Check something else. What else about daughter was stressful at that time? What was the biggest pain in your neck? Do you have an idea?
Mm-hmm.
Yeah, think about that.
Yeah.
That was much more powerful than the first one. So I'm just going to ask you that one question. Is that okay with you? I'm just going to keep asking, what's the hardest part about that? What's the hardest part about that? You probably want to punch me, but it's okay. Hang in there. So whatever it is that you were just thinking about, what is the hardest part about that for you?
Guilt.
Guilt? Push. Yes. Her body says yes. It weakens her right away. Okay. And for you, what's the hardest part about guilt? I know these are hard questions, but. Put it this way. If you had to live, so right now you're experiencing some guilt, right?
Mm-hmm.
If you had to carry this guilt with you for the rest of your life, where would that leave you in a word? What word comes to mind?
Broken.
Push? Yeah. All right, so I'm going to have you put this right here on your forehead and put this wherever you feel that sense of broken. Is that right there?
Mm-hmm.
I want you to just do big breaths. I don't want you to have to just focus on positive aspects. I want you to go right into that feeling of broken. On a scale of 10 being painful, 0 being, you're totally at peace with it, where are you at?
Probably about a 9.
Okay, she's at a 9 out of 10. The sense of broken relating to something with her daughter, we don't know. It's not really that important for me to know. It's not important for you guys to know. But inside, it's important for her to know that she's been carrying this guilt. And deep down, the hardest part of the guilt is that she feels broken. It's now become part of her identity. And I want you to just keep breathing through that. You can take all the time in the world. We're here for you. Until you take that feeling of broken and you'll notice it'll start to kind of peel away. When you get to a 0 or 1, just let us know. Yeah? Feel better?
Mm-hmm.
Okay. How you feeling?
Good.
What's the pain in the neck right now?
I wasn't even thinking about it. So,
Do you feel it right now?
not really, no.
You just had an 8 out of 10 though.
Yeah, no.
And you don't feel it anymore?
No. Mm-mm.
I can't make this up.
That's awesome. Thank you.
You're welcome. That was awesome.
That was really awesome. Thank you.
You tracking? 75% of someone you love is water. And if that water is vibrating at the vibration of I'm broken and I'm carrying guilt, are you going to be able to live pain-free? Right. So what I usually do after we find that like core yuckiness is what's the positive aspect of that? What's as far away from broken as you can possibly get? Strong. I love it. So your affirmation, are you into affirmations at all? Mm-hmm. Okay. I want you to ingrain this in your soul. I am strong. I'm serious. It's so powerful. And when you're strong, how are you feeling? Great. And what's something you could do every day and to increase that feeling of great? Help others feel strong. That's your anti-pain remedy right there for your neck. Does that help? Mm-hmm. When you think about the current situation or the past situation with your daughter, do you feel a little bit lighter?
Yep.
You guys can do this? Okay. That will lead us into our final thing today, which is called protection. So now that my lovely assistant, who we didn't plan that, now that she has basically cleared out some of this gunk, think about it like this, like we have like all this stuff around us. We can't see our feelings. You know, we can't see our thoughts. We can't see our identity. You can't like watch like, oh, I'm broken. That's right there. So we have a physical body that lets us know. That's why it's like tracking with me about how the metaphor happens. So this is kind of all floating in there. Einstein's equation explains how this could happen. But more importantly, now we need to protect ourselves from other people, right, and their negativity. And that goes into the 3 most important things that Vic Frank said, which is blood sugar balance, drink your water, and protect yourself. Okay? And I did a YouTube video on this. It's like a guided meditation. It's super easy because I'm terrible at meditation, but I just happen to be good at this one. And that's all you need. It's 12 minutes. You can go to my YouTube account. I'll put it on tonight. I haven't actually launched it. My brother put it on there. And it will walk you through how to do this. Basically, you fill yourself up with white light, and you put on this like, kind of energetic shield, and I will tell you, it makes a difference. In fact, it's so important. Let me give you an example. If I treat people and do this stuff all day, I'm surrounded by gunk, right? There's a lot of toxic sludge when you get into people's stuff. I started having like full-on, I was hurting everywhere. I felt like a fibromyalgic patient. And I would do this, and when I would do it, I wouldn't hurt by the end of the day. When I would forget, I'd hurt by the end of the day. So that's how important that is. And over time, that makes a big difference. And if you have a higher vibration, if you're doing life at a higher state, we know that like attracts like, right? So you're going to invite in positive things into your life, like strong things and strong people, or are you going to invite broken people and broken things into your life? No, right? Does it make sense? And that's kind of what I got for you today. So I'm going to wrap it up with that. Thank you for coming.